Hello, I'd like to say welcome or welcome back. The purpose of this little slide deck is to focus on how to diagnose and treat physician burnout. My name is Doug Gray. Imagine on your shoulder, we can be that hand. I think there's an awareness that we need to go beyond Hippocrates when people have asked this question, and today we need to ask, who's taking care of the caregivers? Be on this webinar in part because you know somebody who has had a tremendous career, but they're not a superhero. You may know the statistics. They're horrifying to me. 40% of physicians admit regular self-medication. 15% of physicians have admitted to feelings of suicidal ideation in the last 24 months, and virtually 100% of physicians have experienced burnout at some point in their career. So what are you going to do? That's the purpose of the slide deck, and yes, it's a more clinical and factual approach from now on. I'm of the opinion that we can diagnose, we can prescribe treatment, and we can certainly provide care. Why do I have this opinion? Because I've been doing it for years. The slides will provide some content and structure and next steps for you. So the AMA definition is buried somewhere in this word cloud. Think of a depressive disorder that can paralyze you. Some studies state at least 60% of the physicians in your practice group are experiencing burnout right now. So look to the left, look to the right, and look in the mirror. Here we go. 2 quick slides to think about self-diagnosis. 2 sides of the same coin. Resiliency is defined as the capacity to adapt successfully in the presence of risk and adversity. So you can ask yourself these questions, but if you're truly daring, you could ask your team. Have you noticed any change in my behavior? Have I become more abrupt or judgmental? This is one of the ways in which we assess groups. A second way is by using validated and reliable assessments such as the Maslach Burnout Inventory. We take that data plus qualitative interviews and observations as a tremendous way to make sure we can diagnose what's going on. No one succeeds by themselves. It's a myth. Healthcare is a team event, and so is individual and organizational change. Based on these 2 questions, how do you know if you're suffering from physician burnout or at risk? And secondly, what are my options for treatment and care? All about moving forward. That's what coaching is, now and next. Think of scrubs. One doc told me, I envy these guys. They get to say what we cannot say. Here's the science. Physician burnout and gender differences at different stages in one's career. Note that the mid-career folks, 11 to 20 years after residency, experience the highest degree of burnout. The tragic big picture, roughly 50% of all physicians complain of burnout, and that 50% is higher than any other profession in the United States. By specialty group, the study is 2013 by Dryby and others, published in the Mayo Clinic Proceedings. Primary care is orange. You know where you are. MRI imagery, we certainly know that we can graphically describe stress and stressors. One leader in this research is Richard Boyatzis at Case Western Reserve, but there's plenty of evidence to support these points, these 5 points. And I suspect that's the reason why you're looking at this clip. You may know someone who exhibits these behaviors. You may be concerned that you are exhibiting these behaviors. So that's one side of the coin. Here's the other side. The same 20 or more studies. My experience is that these are 5 reasons for us to work together. CBT is cognitive behavioral therapy. It's a psychological process that recognizes choice and personal strengths and includes regular behavioral feedback. I hire a dentist when I need dental work, and I simply don't understand why some physicians wouldn't hire a psychologist when I need to develop resilience for myself or my team. So how do we do it? Behavior change starts when we modify the cues, change the routine, and provide ongoing rewards. So I've discussed these next 3 slides in depth on other little video clips, and they really deserve that much attention. My experience is that self-care in these ways is the place to start or focus. Individuals change history. According to the AMA, when physicians and nurses endorse the Hippocratic Oath, they're upholding that key value of patient care before self-care. And many organizations list those key values on placards in the lobby or identity badges or daily meetings. So what are the top values of your organization? An organization that values compliance and efficiency is very likely different from one that values continuum of care or services. Efficiency implies that you have the facilities, equipment, technology, and resources to do your work. If not, how do you gather those essential resources? There might be an appeals process. It might take months before you get a reply, or it might be that you speak to X, and X is the person who gets it done. Effectiveness is the measure of quality. How well do you do what needs to be done? Outcome focus is that common complaint by physicians who sometimes say, I'm a staff interventionist. I'm working from checklists. I'm nothing more than a glorified waiter or waitress. I spend 40% of my time now interacting with machines instead of directly interacting with patients. Reality. So my perspective is that burnout is avoidable organizationally. If the values and resources at your organization are not adequate, you've only got 3 choices. Advocate for change. Quietly ignore them because they're examples of external locus of control and you can't change those things. Or 3, leave the organization. Physicians still have more career options than most professionals, and I often help folks who are in transition. Autonomy is that subjective feeling of independent choice. Some physicians complain about EMR or the Affordable Care Act simply because they are externally imposed requirements for change. They challenge your sense of autonomy, and you like autonomy. Well, flexibility is a coping mechanism. It promotes internal locus of control, ILOC. There are dramatic examples from history and concentration camp and authors like Viktor Frankl. They talk about the need for flexibility and mastery over the internal variables, like what we say or what we do, even when we feel oppressed. And yes, many physicians feel oppressed. Throughout our 4,000 years of recorded history, we've demonstrated work-life integration. Balance exists. It's a myth to think otherwise. Tension exists. We do respond to external stimuli, and how we do is the key. Healthcare attracts the most intelligent people to our schools, to our culture. These are folks who desire to serve others, thankfully. And for generations, that calling has led to medical journalism. Reverential attitudes such as the doctor knows best are part of our culture. But now we have a consumer-driven healthcare model driven by unparalleled access to healthcare innovation, information, reviews of doctors, and lawsuits that can ruin careers. So on average, you may know physicians take home less money today than they did 10 years ago. Those financial tensions are going to lead to continued burnout by specialty and even more telemedicine. The role of physicians is evolving into more of a collaborative role, an advisor role, rather than an expert on some pedestal who needs reverence. I don't mean that in a pejorative or negative way, just a descriptive way. There are changes in med school admissions programs now that reflect the need for the next generations of physicians to be motivated in different ways by service first, by psychological and communication skills second, and third, by financial rewards. I suspect this will change in our next 20 years. So a central question to this little webinar course and webinar is, what's meaningful to you? When physicians and nurses create work environments that are in accord with their values and in accord with the organizational values in these 2 slides, then resilience is going to prevail over burnout. You're not alone. Reach out. Ask for some help. We all need coaching and consulting at times. Be glad to be our next resource for you or your colleagues. My name's Doug Gray. It's not a scary process. Look forward to talking soon. Thank you for your consideration. Here are some additional resources that may be useful. The Maslach Burnout Inventory can be viewed and used. This version is for physicians. I invite you to take it. One example of resilience curriculum that's being used in med school programs is at Dartmouth, where I did my graduate degree in psychology. The primary goal of evidence-based resources listed here are to promote lifelong engagement in medicine and to minimize the factors that stifle personal growth and learning. There are lots of conferences happening now designed to foster physician resilience, integrative health, and self-care for healthcare leaders at many levels. One's at Georgetown. Academic partners there include Vanderbilt, the Mayo Clinic, University of Minnesota, California, Cincinnati, and Maryland. There's also an emerging body of skills training, mind-body skills training. Here's one link to Ohio State, and there are similar programs at countless universities.